I welcome you all for the VIII Creative Theory Colloquium 2021. The title for this year's colloquium was COVID-19 Pandemic, Grassroots Experiences and Democratic Responses. The colloquium was organized by Foundation for Creative Social Research.
We have two speakers for this session. Vasavi Kiro, National Organizing Secretary, All India Tribal Literary Forum. And the second speaker is Bijay Upadhyay, who is a writer, poet, social activist, and advisor, Adivasi Sangh, working in Malkangiri for more than 3 decades now. The discussant for this session is Abhay Sagar Mins, who is presently an associate professor at PG Department of Anthropology, DSPM University, formerly Ranchi College, with 12 years of teaching experience. Rapporteur for this session will be Nitish Kumar, MA student at Center for Political Studies, JNU. I would now like to request the chair to take over and begin the discussion. Thank you.
Thank you, Survesh, for this invitation to be part of this session. I don't see the speakers. Are the speakers?
Yes, sir. I just checked. I think they have not joined us yet.
Mr. Upadhyay is already there. His video is on.
Yeah, Upadhyay sir is there. We can begin with him. Others are joining.
Yeah, we can start. Okay.
Yeah. So this is a session on tribal affairs and the livelihood. Of course, COVID is much larger than just mere livelihood, and the fact that we have been through the pandemic for almost nearly going to be 2 years. There has been 2 phases, and I think in the 2 phases there has been a lot of issues as far as the tribal population is concerned. The first phase, of course, I think the most obvious and most devastating was the movement from the place where they were working back to their homes. And since there has been substantial movement of the people from the villages, from the tribal communities to the cities, not so much for the skilled work, but for manual work, like domestic work or construction workers going into the brick kilns. So the destinations of the tribal workers generally, by and large, tend to be somewhat different than the non-tribal workers who basically move to the cities, except for the construction workers. Otherwise, you find that there's a general tendency among the tribal workers to fill up the vacancy which is created by the non-tribals who actually really move. So the whole directions of the movement or migration is tends to be somewhat different in case of the tribal communities. It's not to deny that large chunk of them since the last 2 decades or so have been increasingly moving into the urban space. But again, as I said, that very menial kind of jobs, domestic workers, construction workers, some maybe a very small segment in other informal sector. And this pandemic has definitely drastically affected them. There's no doubt about it. And the fact that they are very vulnerable in terms of their access to livelihood, in terms of the fact that large chunk of people from these communities fall below poverty line, and also very poor health status. Whether you talk about the infant mortality or child mortality or under 5 mortality or maternal mortality, you find that it is much more pronounced and conspicuous, or the degree is much larger as compared to other population. So also we know about the literacy. So this is, in terms of economic and social indicators, turns out to be one of the most vulnerable communities. And since as it is in the normal situation, they are vulnerable naturally. When the situations like the pandemic comes, then I think it's going to affect them very drastically. And I think it is something, it is an important as to how they have been coping with various dimensions of their life, particularly the livelihood. This is an interesting theme, and as to how the people have actually responded to these issues that's at a grassroots level is something we all need to know, because the tribal communities are spread over the length and breadth of the country, and therefore the way they may have responded might be very different, let's say from region to region. But nevertheless, the presentations which are going to be made is a sort of illustrations of what and how they might have coped. And it is in that sense that let's first listen to this. I think there are two presentations, and may I therefore invite the Bijay Upadhyay. Can you start, please?
So, I'm going to present my paper, which are written in 3 stages. One is at the middle of 2020. The second, you can say that these papers are reports from the field in Malkangiri. One is written in 2020 June. The second one is in 2021 February, and the third one is only this week. That is September first week. So, in short, I will try to present this. I think I am giving 12 minutes. How much time I have?
It take 15 minutes.
Okay then, thank you. Let me, since it is a question, it is about livelihood. On tribal livelihood, there is a nice poem in Odia written by a Dalit poet, Akhil Nayak. He writes, "Mitti thi, desh nahi tha, हमारे बाप दादाओं के सांस मेद हड्डी से मिट्टी हुई और भी उर्वर। पानी था, देश न था, हमारे बाप दादाओं के खून पसीने आंसू से पानी हुआ और भी मधुर। हवा थी, देश न था, हमारे बाप दादाओं के तुष्ट सुघड़ सांसों के हवा भी और भी शीतल। So these lines, they speak of the means of livelihood, which were by and large snatched away from the tribals, snatched away from the Dalits, and now the tribal who is really going away from his village, from his land, from his state, that is a sort of forced ouster. He has been forced to leave his land because he does not have any livelihood here. So with this, let me start with my papers. So since March 22nd, 2020, when Orissa was locked down to fight COVID-19, Malkangiri district was a green zone for about 2 months. The numbers of infected patients got momentum only after May 15, when laborers from outside the state started passing through this district via Motu and Chitrakonda. So slowly the number increased, and every day at least 1,000 migrant laborers, they passed through Orissa. And nobody knew that so many people who are working as laborers in distant places, and now when they came by walking, by whatever means they got, and facing deaths, facing structures, facing sun and rain on the way. So it astounded everybody to find that so large numbers of migrants can come. This was beyond expectation by the administration. From Bihar, from Jharkhand, from West Bengal, workers have gone to southern states, and now they are coming, and when they walk down, they have to come via Malkangiri. The place which is generally known to anybody. But this is the way which is nearest to their own places, own provinces. The government report reveals that average of 1,000 laborers arrived at the point of Motu on foot, and about 500 laborers every day at Chitrakonda. They came by foot, they came by bicycles, they came by motorbikes and all kinds of four-wheelers, some of them taking their last breath on the way. Recently, that is during the first week of June 2020, the average slowly came down to 500, and they were offered shelter by the government. But anyhow, it was found later on that the Malkangiri Dadan laborers or the Malkangiri migrant laborers, they are also not less. Their number given by the government was 20,000 in the month of June in 2020. Slowly the medical treatment and the quarantine centers, they were done away with by the state, and the laborers were asked to go their home and stay in isolation. And in this way, slowly the government closed whatever help it was giving. Actually, before COVID-19, the economic situation in the tribal areas were very, very peculiar. Everybody knows about it. It was in a doldrum, and nobody bothers about the fate of the tribals, where they have gone or where what they are doing. They lost all their savings after this COVID. What happened is they have to spend all their savings. The workers have to spend all their savings in their way. They were almost looted by the transporters, and they after coming back here, they did not find any work. They were given Norega work by Norega scheme, only Norega scheme. They were given work only for 1 month maximum. So what will they do? This was the big question before them. Many of them started living within 2 to 3 months to their previous workplaces. And while living, they have to face again a lot of difficulties. There were accidents, there were contractors repression on them. They have been asked to come with false promises, and in this way, about 50% of the workers who have come back, they started going back by 2020 itself. By the end of 2020, we found that almost all the workers have gone back to their previous workplaces or to new workplaces, and the workers were getting moderate wages in their workplaces, but as they say, as they report, they were getting something between 350 to 700 rupees daily. And here, Norega work, whatever time they worked here, they were getting only 200 rupees. So they compared this. Why 200 rupees every day? Why not 350? Why not 700? And they were not given any skilled work here. They were only given earthwork, and nobody was associated with such sort of work. The earthwork also did not continue for a long time because machineries came in. JCP machines came and they really worked, and the workers were thrown away. The suggestions which were given by the social workers, by the social activists and the economists in Orissa, you can have some local industry where these workers can be engaged with the raw materials available here, and certain enterprises can be constructed, and help can be given for this. This was suggestions given to the government through newspapers, through various columns, but the government did not listen to this. And these are meaningless unless strong policies are evolved for the sake of the people. The government seems to be never willing to spend anything on the poor. Compared to other countries, I think the lowest help in other countries for these COVID affected persons was much more than our people got here. So in this way, people are very dissatisfied, and they again went back. So in 2020, in 2021. February or January, when we made a second round of investigation, at that time, whatever we found, actually, I have concentrated upon the women laborers who have gone and what is their fate. This was my focal point, and whatever I found is noted down like this. The entire Koraput district, with its diverse cultural richness, faced the utmost uncalled for disaster in the form of COVID pandemic in 2020. The great exodus of migrated and Dadan laborers from far off places and states like Jammu and Kashmir, Kerala, Chennai, Hyderabad, Delhi, Punjab, and Haryana, etc., took place towards Orissa in the first 3 to 4 months in 2020. And by the end of the year, that is from October to December, almost all of them have gone back. Government propaganda to engage them in energies fell flat. Immense difficulties, hardships, and police atrocities faced by them on the way back home were no doubt unforgettable. But when work was not available after the seedling and harvesting season, they gave a reconsideration to the proposal put before them by the agents of the contractors of going back to their earlier workplace, new places. At the approach of second wave from May 2021, the exodus was tripled. This time, double of the passage money was sent to them, and promises of continuous work and higher wages were given. Some factory owners sent vehicles and cash through the middlemen. Roughly, the percentage of such returnees going back to old farms amount to 50% initially, and later on it crossed 100%. So recently, I met some women workers in 3 panchayats: Tarlakota, Potrel, and Chitrakonda. I also contacted some women leaders in Chhattisgarh border areas, that is Komarpali and Mahukadar panchayats, and talked with them. So what I got is actually I found that Koya girls, Koya is a community who is very militant, who fought against the British. Their leader was Taman Dora, and these Koya community, they were women from their community were first to work as migrant laborers in distant places. In the earlier days, whoever were going, leaving their village and going as workers to different distant places, they were being treated as vermins. That is, as if they were social evils. But slowly, this attitude changed, and they are now being treated with respect and equal. They are treated as equal with the other male employees who are earning something in the distant places. Their numbers also have increased tenfold, and especially the tailoring training centers, the skill center at the district headquarters, started sending them to different apparel factories since last 5 years. They were generally sent to Delhi, Bombay, and many places in South India. Their social status thereby has increased. And I found 20 girls in 20 Koya girls in Komarpalli Panchayat. They were mainly engaged in two fields. One is construction field and another is apparel factories. They were in their workplace. They were provided dormitories for stay, and living space was very little, 2 feet by 6 feet for each, and it is almost as if they were in a prison. They had no alternative. They had to stay there. So it is observed that women from other communities rarely go outside, not even with their family members. Only the SC people, that is scheduled caste people, they, as well as these Koya community girls, they go outside to work as migrant laborers. And it is found that at certain places at a certain place in Tamil Nadu, about 100 women, all of them Koya and Harijan, that is this Dalit girls, they were detained by their employees with the promise that their allowances of 3 months will be given soon. But they were never given, and they left their place after 4 months. Others who did not agree to the proposal of the owners, they had to walk down. So in this way, I met a girl whose name is Chandrama Kabasi, belonging to Patel Panchayat, who has been regularly going to Hyderabad, that is with 20 to 25 Dadan workers, both husbands and wives, to work as construction laborers. She herself was working as a cook, and monthly allowance was about 7,000 rupees. And in this way, she has come back and promised that she will never go back. But recently I found that she has also gone not only with 20, but with about 50 other migrant laborers in the month of April. So, pandemic or no pandemic, Dadans now feel that their livelihood question is the main question, that is the principal question. So, wherever they get work, they should move. Because they searched for work locally, and for some time they got with this case of Chandrama and her husband Dharmender Nagul. Nagul worked as a driver, and she worked as a loading unloading laborers. But this continued only for 3 months. After 3 months, they were given no work. There was no work. So they were bound, they were compelled to go back. So this compulsion. And another case I have studied, that is Malati Buruda. Malati Buruda also came back and promised that she will never go back. And now I found that she has gone back. So the pandemic has broken the good relation between the employer and employee. The fellows who had gone there, they did not want to go back to the same employer again. They searched for a new employer, and they got also. And the purpose for going for work in distant places is mainly to pay back loans, to find some amount so that they can spend it for their education of their children and for the health of their children. So recently, I have written this report. It is a very small report. Export of labor from backward and agency areas to advanced areas have become the norm of the time, and I think that is the new labor policy of the state. The hands behind such export are unseen. Thus, it has taken a new dimension, a new denomination also, they are never told that, it is never reported that something wrong is happening. The migration of labor has become a norm. It has been projected that this is quite willfully done to make it more concrete at present. In place of private vehicles, which were sometimes checked and detained, line buses have been introduced. Strangely, I found that since last 2 weeks, a bus is flying from a very interior place, that is Mohpadar and Salmi. From this area, buses are flying every day to Hyderabad. That is mainly meant for these dadon laborers. Regularly, these private buses, they are running, and another bus is running from 79, MP 79. They are all meant for these migrant laborers. So apart from that, it is also found that at least 6 boleros, four-wheeler vehicle which were carrying these dadons, they have been detained. The dalals, the agents have been arrested. So how to avoid this? To avoid such detention and such checking, such detection, they have introduced these line buses. Earlier also line buses are there which were running to Bhadrachalam and Khammam. So now directly buses are flying to Hyderabad. So
could you wind up?
I'm finished. So the registration of these laborers, earlier they have promised in 2020, the government has promised that registrations will take place very quickly, and they have already developed a system of registration. But at present it is found that really there has been no system, no report. RTI application, they do not reply. The government also is leasing the land of Malkangiri. At least 84 leases have been given of the forest land to the miners, that is to the mining corporate houses. And these 84 leases, it is found that people, the Gram Sabhas, they do not know about this. So the land alienation has been accentuated by the government itself. So earlier the private parties, they were really alienating the land. They were taking away the land. Now the government itself is taking. Its argument is the land is not Pota land. It is not in the name of the tribals. So in this way, new people, I have found that about double the number of the migrants have gone outside this time. So the number, why the number has doubled? Its reason may be these new leases, big chunks given to the corporate houses, and there is a insecurity, feeling of insecurity. So what shall we do here? Because cultivation, the moment the seedling ends, the moment the opportunity to work as agricultural laborers ceases, people have run outside to work as laborers. Anywhere they get things, so get work. So this is the situation, and only at last only I shall say one thing: the right of laborers' right is a question about which these migrant laborers are conscious, but they cannot do anything. No union helps them in their workplace. And here also, whenever we try to organize them, it failed, because whenever any migrant laborers leaves his village, he never declares it. Only a small group, they keep the thing in between them and they leave. And this is going on since last 3 months. So it is a challenge before us, before the organizers, before the activists, how they, at least they can be made conscious, and they can be given their rights, and wherever they work, whether in Orissa or at outside, how they can be organized, unified, and they can fight for their rights. This is a question before us. Thank you.
Thank you, Bijay. Neelam, can you hear?
Yeah, hello everyone. I think we had really a wonderful and very illustrative paper with us, and there could have been no better background and tone that what Professor Xaxa said for us. Rest of the discussion concerning this paper, the commonality and the specificity of Adivasis, and also among Adivasis, and especially in the situation we are right now in the pandemic and its implication, the specificity, the implication of this specificity and commonality in the context of pandemic. Even sir in his presentation has very much illustrated the terrible conditions that were pushed into, that the Adivasis or the tribals have been pushed into, especially during this pandemic. The long walk to their home, the brutality of administration, and the police, especially that they happen to encounter on their way, the loss of jobs on their migrated places, for example, and also the lack of local jobs on their return, and the very difficulties very specific to their location. And as sir was saying, informing us through his presentation, that they really had very unforgettable mark in the history of, we had very unforgettable marks in the history of our nation that we have seen, and also of humanity. Sir also illustrated very vividly the difficulties and challenges tribal faced through very specific and vivid examples from across the nations, from south to north, and especially from Orissa. And that were really very heartbreaking also, but also very illustrating to actually what happened. And we have seen that through televisions, and probably we have seen in our real life conditions. But then he has that we sometimes seem to forget through the time, but then he again has brought before us all those horrible pictures before us, and especially in the context of what better could be done in the days to come, especially when we face situation like this, and especially for most vulnerable population in our country, and what better could be done to cater to their needs, especially in the context of a pandemic and any time, like any crucial time like this. Thank you, sir, very much. I think we really get your the experience. You have actually transferred your experience to all of us. I think this will have a very large implications for what we think, what we write tomorrow, and the policies that we engage with, and to actually implicate for communities, Adivasi communities specifically. Thank you very much.
Thank you, Neelam. Now the paper is open for your comments or queries in case you have. Yeah, Vasavi, can you start your presentation?
Yeah, good afternoon, everyone. What I have to say. See, this pandemic and COVID-19, it's terrible for every people. And as far as concerned with this tribal community, indigenous community, it was less impact on Adivasi community, tribal community. In Jharkhand, less than 3% impact on Adivasi community. We have analyzed and we have collected some data, and whatever monitoring and everything was going on since 2020 March. Another thing is that is very important, which is not concerned with all of you people. It's a indigenous system of knowledge and indigenous system of medicine. There are a group, and we are working on ethnomedicine, homeopathy, tribal medicine. It is not recognized by Indian government and any state government. But in tribal India, tribal people, they are working on indigenous system of medicine and indigenous system of knowledge. So tribal people, they are saying that they have some very good knowledge to combat this novel coronavirus. And it's very peculiar as globally all people are watching and analyzing that WHO, their role was very negative, and WHO is still not able to uh, identify, or I can say not able to put a name of this disease. Every people we are saying coronavirus. It's a virus. COVID. CO means corona, VI virus, and D for disease. So it's a coronavirus disease. And what exactly it is? It is pneumonia, it is malaria. What exactly it is? All scientists are there, very big anthropologists are there, health ministry, WHO, and many things around the world. So many research institutions are there, big scientists are there. What is happening? Still we are waiting for a good name of this disease. In 1918-20, it was a Spanish flu. More than 1 crore people were died. And now in India, about 5 lakhs people, they died from this novel coronavirus. But still we are not serious. Health ministry and this latest BJP government, they are not serious about it. So if I talk about tribal knowledge and tribal indigenous system of medicine, we are not afraid because we have medicine, we have knowledge, and we can combat this novel coronavirus. But what about other communities? In Ranchi, this year in 2021, in the month of April and May, every day 150 bodies were coming out. It was breathing trouble. People were not getting this oxygen cylinder, and hospitals were full. So in that time, no proper communication, no proper dissemination of information about novel coronavirus. It was not available. So it was very difficult for common people, non-tribal people in Ranchi. And being a human being, we were in trouble, and we are trying to resolve, and we were trying to support these people, local people, those were facing all these problems. So all in Ranchi in Jharkhand, for an overview, you can say that in Jharkhand, in rural area at community level, no impact of coronavirus. State government has done a survey, health survey work conducted by Jharkhand Health Mission. As per this survey, they found that in rural area, in tribal area, this blood pressure, BP and sugar and typhoid, it's very high, and TB, tuberculosis. But very less novel coronavirus patients we did not get in rural area, in Munda area, in Santhal area, in Urao area, and in Hillies area, where primitive tribal people, Pahadia and Birhor, they are living. So as a whole, I want to, I gave this an overview regarding this novel coronavirus. If there are any questions, I can reply. I have already tired because there were Second World Conference of Indigenous Women were going on since 12 August to till September 3. So I am very much tired, and I did not get proper communication from your side. I am sorry. Because late 11 hour you people had contacted me, so I want to wind up this or to say all this. Thank you so much.
Thank you, Vasavi. Yeah, Professor Mohanty, I think discussion. Neelam. Sir. Neelam.
Hello. I think Vasavi ma'am has brought us before a very different picture from what sir was explaining to us. The resilience capacity of indigenous people, especially tribal people in India. I think that is very important point that she was raising. The knowledge system they have of the environment, of how to deal with crisis like this. And as she states that in places like Jharkhand and specifically Ranchi, around Ranchi or rural areas in Jharkhand, people have been able to combat uh, the impact of corona in much better way than the rest of the community. I think she must be having a lot more experience and data and all that, but due to the lack of time and all those the concerns she raised, we were not able to get to that. But I think that, she also has raised very important point that the different knowledge system that different communities have in India, not just indigenous people, but then a lot more communities around the world have some very specific knowledge system, and they might have some solutions for the crisis that we face today, environment or ecological or economics or including corona crisis. I think that's a very important point that she was raising. Thank you very much, Vasavi, for that.
Yeah, so the two papers, we open it for your comments. And Professor Mohanty, I think he wanted to raise.
Well, we had a weekly discussion running for 1 year where Bijay Upadhyay continued to participate and report, and therefore we were enriched by his contributions also on Zoom, and therefore I was quite happy that he was able to aggregate the whole period's experience with many new insights which I wasn't even aware of. And Vasavi added a very important dimension about indigenous knowledge, and where the two fit together is that you'd notice that Malkangiri did not have cases until the migrants passed through. Migrants who some of them carried it from the workplaces, and then it spread to those areas. Now, Vasavi's point about indigenous knowledge, we also saw that point raised by Ritu Priya about politics of knowledge, and how the government on the one hand has a Ayush ministry, but on the other hand, has very dogmatically insisted on a certain kind of treatment, not allowing any respect for other kinds of treatment, even though scientifically or modern scientifically sort of demonstrated, verified treatment system has to be relied upon. But the question is whether it can coexist or can also be operative in consonance with the indigenous knowledge systems. Now, I would ask Bijay a question about the Bonda community experience. Now, they were considered to be immune for quite some time. And then there were reports of, Bonda community is one of the particularly vulnerable communities in Malkangiri. So, can you tell us about this particular experience of the Bonda community and what is the latest? Because there has been quite some debate about the immunity, and that's where Vasavi's formulation can be tested. I mean, how the indigenous practices and knowledge systems have been challenged by the modern interactions and the marketization, as a result of which we cannot just protect or operate the indigenous knowledge system by itself. So the situation has become very complicated. and we have got this from some African studies, that some African communities were absolutely, they were happy, and for almost early 2021, there was no report of any COVID cases in many African countries. And then suddenly you find, the urban and tribal interaction and so on have right now in Africa, these cases are rising. In other words, the isolation or the autonomy of the indigenous knowledge system and indigenous life pattern is no longer there. So how do we confront that situation? I would ask this question to both Bijay Upadhyay and Vasavi.
Are there some more questions?
Yes.
Bijay, you can.
Yes.
Mitti also has a question.
Yes.
Yeah, please.
Yes, about Bondas, I will mention two things. One is, at the first wave, there was not a single case among the Bonda communities, as Professor Mohanty has told. Only in the second wave, there were some affected persons, and that has really troubled us, because they are by their own lifestyle and their practices of their livelihood, they do not go out. This is known to everybody. But one thing that has happened among the Bonda community, they are working as laborers in other places of the district. In Malkangiri district, they go from place to place. They work as agricultural laborers, and they are the best agricultural laborers. So the sahukars of the district, they always prefer to these Bonda people, Bonda laborers. So Bonda laborers were brought from their hills to different places in Malkangiri, where they work not only as agricultural laborers, but also as construction laborers, as loading and unloading coolies. They are the best laborers according to these hawkers. So perhaps this has attributed this later infection. But one thing, not a single Bonda patient has died till now. They were affected, and government was troubled because they did not, they will not accept the outside medicine. But they adopted some of them, which were really at the outskirts, these Mudulipada, etc., those villages. They accepted masks, sanitizers, and some of the workers, health workers, they have gone distant places and propagated masks. At least for 2-3 months, they used masks also. And medicines, whatever medicines were given by the health workers, they also took it. But somehow or other, the spread was stopped. And I do not know about their indigenous medicine, what they are doing about COVID or COVID-like disease, but they generally do with their own medicines. What are their medicines, I do not know exactly, but they do not bother about the allopathic system. So it is a thing which can be investigated later on. Knowledge system, really we organized certain workshops, certain 2-day workshops for this local medicines, indigenous medicines. And in that indigenous medicine workshop, we did not find any Bondas did not come there. Other community people come, and they spoke about their practices, what they use for what sort of disease, etc., etc. And we have also documented it. But Bondas did not come. And one thing, their immunity system, no doubt it is the best in the among the other tribals.
Vasavi,
somebody was asking about Koya community. Somebody was asking a question.
Nitish, why don't you ask it straight?
Yes.
Nitish wanted to ask it. Yeah, Nitish.
So
Actually, what is the question? I did not get it. About Koya community, somebody asked some question. I could not read it.
I am reading out. So could you please throw some more light on Koya community, that under what circumstances their women went outside to work and not the women of other community? And is there effect on women of other community also to go outside for job, because when Koya community women went outside, social status has also increased?
Actually, Koya community went for work since long, and they have gone, as far as I gather, the Bengali Dalits who are staying along with them, they have primarily they have gone with them. It is 20 years back, I think. 20 years back, when Bengali girls means Bengali Dalit girls, they went outside to work along with their male partners. They took with them these Koya people, Koya girls, and at the beginning, they were treated very, very badly. They were treated almost as Burmans, as I told. They were not allowed to the inside the community, inside the village, and social excommunication was put upon them. So even many panchayats were done 20 years back, I'm telling. But slowly that has gone away. And last decade, the Koya girls who are going outside and taking trainings as skill laborers, they are treated, at least the last 5 years I'm finding, they're treated with respect. And they are not at all being excommunicated as earlier. And other community girls are, not that they are not going at all. They are going, but not remarkable numbers. They are going 1, 2 in this way. In the groups, you can find 1 or 2 or 3 in this way. But they are very little compared to the Koya girls. And Dalit girls, they are going. They are abundant everywhere. Dalit girls are going, and especially the Bengali community. Bengali community are very expert in taking their people outside for work, and they are very clever also. Therefore, they are not tortured as the tribals are being tortured. The reports are coming. They are very smart in that sense. They can go and they can earn and they can come back. Recently, one Bengali boy who was reading in a school which we are running, he was reading only in class 8, and he went to work as a dadon. And after coming back, he told me that I have earned 12,000 rupees within 3 months. And that is after my fooding and traveling and everything, I have saved this amount. So the work culture your school has given me has helped me. This is a Bengali boy, Bengali Dalit boy who was telling me. So at least now, it is not a worrisome thing, but it is a social. It is of social concern that why the number has increased even twofold. The number of dadans have increased in spite of all these tortures, all these all these stories about their woes and about their troubles. So in spite of that, it has increased.
There are Vasavi, you want to comment? Then we have there too. I think Mahendra has raised questions and Dharmendra has them. Vasavi, you want to comment?
Yeah, just few lines. I'm not much interested to speak a lot.
Okay.
Question was tribal people, how they are surviving in this novel coronavirus time. See, now I'm watching this United Nations activities. Indigenous people's food system, it has developed by FAO, United Nations, and continuously they are talking about food system, which is all tribal people, various tribal communities around the world, they are using as medicinal, as a edible item, and they are trying to document all these traditional knowledge, what exactly they are eating, their lifestyle and living. So just I want.
Hello. Vasavi,
that indigenous
disconnected.
system of medicine is very much so I'm very much because we are working with some ethnobotanists, scientists are there in India, in Lucknow, in Kerala, and all these scientists are so
connection problem
in
is there.
Kerala.
Connection is
In Tamil Nadu and in Karnataka. $1,000 patients novel corona virus Kiro this virus. Videos very used for so we are practicing and in Ranchi also. We are running our tribal medicine clinics and so many people they are coming and they are collecting medicines and traditional kadha as Ayurveda people is Ayush this Health Minister of Kerala he has announced 27,000 from these plants, this tribal knowledge, these tribal plants. So we need to look into all these things and maybe there are some issues of IPR, but let us see if it is still Delta variants and so many things are coming now. Children are getting infected. So we can share and we can do something. But in our state now, we have this Hemant Sarkar, this JMM government, we can say, and we are keeping talking with this tribal government. Maybe they will announce this tribal plants as a state plant. Thank you so much.
Well, I think there is some connect.
okay. I think Mahinder and Dharmender they have raised hands. Mahinder.
Thank you, Professor Xaxa. Thanks for joining us this time. I remember our good old days at DCRC. Director there. After a long time, we are having you here. So it's really nice to have you. I have a question about this tribal medicine system. I think the Foundation for Creative Social Research also has a group on knowledge and practice, and we are doing a lot of work in different parts. In one of the villages where we are doing field work in Guwahati, near Guwahati, which is known as a tantric village called Mayang.
Yeah.
We discovered that Mayang actually has a very interesting medical medicine system, which is very local and a lot of plants are there. There's biodiversity. They are using it, but that is intertwined with a kind of mystical thing. So we don't know how to handle that. I'm reading out something news that I collected from Jharkhand about this tribal medicine during the COVID thing, and don't know how to really understand this. This is about a person called Bhim Soren. Bhim Soren is 92 years old person, and he, as it is said that he is a local doctor, tribal doctor, and he knows a lot of plants and treats a lot of diseases. So the news reads like this: आदिवासी परंपरा में संक्रमण व महामारी से निपटने की पुख्ता व्यवस्था की गई है। जब कभी भी गांव में संक्रमण या महामारी आती है, ग्रामीण एकजुट होकर देवी देवताओं का आह्वान करते हैं। इस दौरान गांव में मांस मछली के सेवन से परहेज किया जाता है। ऐसा गांव में पवित्रता व शुद्धता के ख्याल से किया जाता है। साथ ही हर घर में धूप धूना जलाया जाता है। इस तरह कुछ दिनों में ही संक्रमण व महामारी खत्म हो जाती है। उक्त बातें बालीगुमा ठिकड़ी घुटू निवासी 92 वर्षीय भीम सोरेन ने कही। उन्होंने बताया कि महामारी के समय गांव के नायके बाबा यानी पुजारी की अगुवाई में देवी देवताओं का आह्वान कर कांसा लोटा में पानी भरकर जाहिर थान सरना पूजा स्थल में अर्पित किया जाता है। उन्होंने बताया कि आदिवासी समाज इस आस्था व विश्वास को आज भी कायम रखे हुए है। इसी के बदौलत समाज आज तक संक्रमण व महामारी से बचाया जाता रहा। पर्व त्योहारों में नीम दा माड़ी का सेवन किया जाता है, जिससे काफ़ी फायदा होता है। Now this story is like in the Ayurvedic tradition there's a Ramdev moment. I call it Ramdev moment. So I have a feeling that probably there's a lot of knowledge system there, but that is intertwined with certain kind of mysticism or some. And the ethnic medicine is also intertwined with ethnic ideology. The ethno-medicine is intertwined with ethnic ideology. That probably is creating a bit of problem in comprehending these things. Like a lot of people coming and being treated by some tribal plant or some plant or some medicine in the tribal region could also be indicative of low level of virus load in that area. Like when we went to our villages, they said there is no virus here. And in fact, the only person who got infected was me. I was using everything, all mask and everything. And all the villagers were all right. And they were laughing at me. आप तो बहुत करते थे, आपको ही प्रॉब्लम हो गया, विलेजर्स को कोई प्रॉब्लम नहीं है. So maybe their immune system is better because of their lifestyle. Yeah. Maybe a virus load is less. Maybe I had virus which I carried. I don't know what it is, but it's little bit of complex thing. Yeah. The second thing is that one of my friends in Ranchi University anthropology, who is from he's a professor there and he's from JNU. He told me about his father practicing a medicine and not ready even to give the medicine to him. He said, I kept struggling and I have witnessed the impact of the medicine. It's given during the delivery. If delivery is not normal, during the labor pain, the medicine is given. And he said that I have seen with my eyes that 99% cases have been solved, including my wife's case. But when I asked my father to give that medicine to me, the knowledge transfer, he says that you don't have the ethics to acquire this medicine. So neither we are able to verify what kind of medicine is it, nor we are able to really transmit this medicine. So that becomes a bit of problem. I don't know how to solve this problem.
Dharmender ji.
Okay.
Dharmender, please.
I just want to say very, very quickly. I wanted to say in front of Vasavi, but she left. Nevertheless, as far as traditional knowledge is concerned, there is always. Hello. Yeah. As far as traditional knowledge is concerned, there is always a danger of romanticization. And there is always a danger of marketization of that romanticization. These are two different things, and both these things are happening. That's one point. And the second point is, as Professor Mohanty said, look, you can be immune as long as you are not interacting with other community or the other society, or as long as you are isolated. But the moment your isolation is over, you start getting infected with these kind of diseases. So my question is, how long you can isolate yourself? There are many, you are forced to, because of your life activities, to join many economic and political social activities. You will be forced to end your isolation. So therefore, isolation forever is not possible. But points I just wanted to raise.
Hello? Is there anyone who wants to raise?
I just want to say one thing about this. The tribals generally say that there is nothing like COVID. COVID is a nonsense. Then I find it in the whole district, the mask is not being used. And people say, if you go to the field and work, you plow the land, you just have hard work and sweat, then there will be, nothing will happen to you. And that is the only cure. And in a particular village where 37 people were marked as COVID patients, and they were asked to remain in isolation. So after 2 months, when I went to that village and asked them what has happened to the 37 people, they said nothing. We went to, in the isolation period, we went to our land and plowed the land and put gourd like vegetable. Jhanni, we tell it jhanni. We cultivated gourds and sold it in the market, and that is our care. And maximum I have found that they take hot water with
Yogi had also said one.
Yeah,
this is what Yogi Adityanath also had said. Yogi COVID is nothing but the influenza and the cough and cold. Yeah. But he was forced to change his stand, and not only the second phase of COVID that is another approach. It doesn't spare anybody. It doesn't spare anybody. So romanticization has its own limit.
Yeah, that's right. Yeah. So I think we are already through the time. I think it's a COVID in the context of the tribes. It's an interesting issue, and not much work has been done, except that some of the way in which government has been trying to address the issue of livelihood that has been one generally finds in the what is called the Ministry of Tribal Affairs website. Other than that, you do not really find anything about it. But then what has really also happened that whereas there has been a COVID phase, there has also been by central government trying to compromise with the environmental impact assessment, social impact assessment, and then the 41 what is called the coal blocks which were leased out to some companies, which was again in Orissa, Jharkhand, Chhattisgarh, and Madhya Pradesh. So these are problem issues. But I think larger issues is that how do we really address? Because even though people feel that when they have there is a aspirations to go to the cities, that it's on charm because of the wage, because of the lifestyles, and there are problems, but nevertheless they feel quite comfortable of being in the urban space. But when such situations really come, then they have to come back. But the problem is that again, so in spite of the fact that they have experienced something very dramatic, very difficult times, and yet again desire to go back is something I think we all really need to reflect upon. What is it really that is there? In the sense, this is more of a psychological, but I think it's an interesting questions to reflect on that why again, despite having seen the tragedy, one is really pushed to go back again and be a part of the urban space. That secondly, I think the whole development that as a state government has been doing, again this I think we have to really think is a skill development, in the sense that government is taking skill development and in a way they place them into certain industrial sectors in Coimbatore or Hyderabad or Bangalore and so on and so forth. And I think it's just placing that seems to be enough, in the sense how to secure their livelihood, how to secure their wages, how to secure their working conditions. These are all not really taken into account. So the governments think that they have skilled these people, and then now these skilled people are actually ready to go anywhere in the country. But then terms and conditions, what is called the wages, the salaries, they all remain very not up to the expectation. Yes, to the expectation up to the place of origin. But if you really go to the place where you're working and the kind of wages they are really getting, they are far below what the local people actually get. That is happening in even organized industry like the tea. If people from Assam or Bengal, they go to Kerala, they do get wages, but they don't really get the minimum wages which the people there are entitled to. These are issues that have been there. And thirdly is that, I think what I sometimes feel that keeping the tribals in the context, we are back to, I don't know, because what tribals are going through after 1991, after what is called liberalizations and what is called globalizations and market, is that one really sees colonialism back to the tribal areas. In the sense that you look at the whole recruitment process, this is precisely what the colonial state did in the what is called middle of the 19th century, early 20th century, recruiting people from these very areas and taking it to the Assam and Bengal. So it was very organized system of recruitment. Now that organized system of recruitment, in spite of the fact that we are now 70 years after independence, continues. So there are certain kinds of economic features or economic institutions which has outlived even the colonial period, and that has become an integral part of the economy. So even during pre-1991, we couldn't really dismantle this whole process of recruitment. It's not a free in that sense of the term. So you find that the whole recruitment of the labor is really taking place under certain kinds of coercion. Either the people are indebted, there is a coercions, there is the force that is really used at different levels, and as a result of which you find people are actually. So it's not free floating labor in that sense of the term, except for the fact that they are being paid wages and they are separated from the land. But other than that, moral questions of liberty or moral questions of what is called autonomy of a person surely is not there. There's nothing like free, prior and informed consent when people are really going. So this is something I think we as academics probably we really need to think about it. The last that I want to talk about is that there is some sense when people are really talking about indigenous system, because I read a book by Arup Maharatna, which is a demographic of tribal society from 1891 to almost 1981, or I don't exactly remember, almost 100 years span, and where he says that between 1891 to 1941, tribals' mortality rate, rather, you find the rate of fertility was much higher among the tribals as compared to the main population, in what is so-called Hindu population. And he says that there was an increase of population between 2.36 to 3.2, whereas there was a decline of the populations of the what is called the Hindu communities from 75 to 69. So for the span of 1891 to 1941, he sees the reverse process. But today we find that the process has reversed, in the sense you find large chunk of mortality and other problems in case of tribals, and you find the what is called the other way is around the context. So this, I think, Kingsley Davis says that actually the maternal or what is called mortality rate was among the tribals between 1891 to 90 was much less, and I think they had access to resources, forest, land, and what is called the system of environment, which actually enabled them to produce more and to have less mortality, as a result of which they can produce more as compared to the mainland population. So there has been there now that access to land and forest that they lived, and which actually gave them vitality, that has got completely eroded in the post-independent India. So they were not vulnerable at them. Of course, they know that there were epidemics and there were what is called flood or the famine, which was regular, and that was also one of the reasons which pushed people to Assam and Bengal or other places. But nevertheless, they knew. So, but when epidemics come, they really affected as a collectivity, but they were not really vulnerable. They were not really without asset. They were not really without access to land and forest. And at the moment, they can always go and fall back to the forest. So that kind of system is not there. But today, when epidemic like things comes, but then you also know they don't have access to land because the forest has been completely taken over by the forest department. The land they have lost, it's become marginalized now because of the alienations and the what is called there's a huge shortfall of the infrastructure in terms of health, whether you talk of sub-center or you talk of the primary health center or you find community health center. So these don't really there's a shortfall, huge shortfall even today. And as a result of which you find that the quality of health in terms of health status is very, very poor. So all these actually, given the kind of pandemic that may come, if they are really affected, if their immune system is very good, I think this is okay. But if their immune system is not good, it could be a drastic, it could be really very dramatic in terms of affecting their lives. So these are some of the few general observations that as a concluding remark I would like to make. Thank you.
Thank you, Professor Virginius Xaxa, for sharing this session. And I would also like to thank our speakers for joining us and for a very fruitful session. And I would also like to thank our discussant, Neelam, for his meaningful contribution.
Thank you for watching the video. Do like and share our video. For more seminars and talk, please subscribe to our channel. If you have any questions, comment on the video and don't forget to press the bell icon for future updates.